Bismillahir Rahmanir Rahim. Welcome again to another important video. I'm Naglaa Elmongy, Professor of Dermatology, Cairo University. So in today's video, I'm going to talk about vitamin D supplementation to reduce the associated risk of COVID-19 infection. Many observational studies have shown a strong relationship between infection with COVID-19 and the low serum level of vitamin D. However, other studies question the significance of this finding, also questioned if the addition or supplementation of vitamin D will help in management of COVID-19 infection. There is a limited information about the effect of supplementation of vitamin D on reducing the risk of COVID-19 infection. And this is very important because vitamin D is already widely available over the counter and it's inexpensive, easy to have, and is associated relatively with few side effects. This paper was published recently in November 12, 2022 and was published in Scientific Reports in Nature. Its title is Association Between Vitamin D Supplementation and COVID-19 Infection and Mortality. The research in this paper was done in the US, where vitamin D insufficiency and deficiency affect approximately half of the US population, with increased rates of vitamin D deficiency in people with darker skin, reduced sun exposure, people living in higher latitude in the winter, nursing home residents, and healthcare workers. The research was a large-scale pharmacoepidemiologic study that studied the association between vitamin D3 and D2 supplementation and the probability of COVID-19 infection, and also its relation with COVID-19 infection ending in mortality within 30 days in the Department of Veterans Administration in the United States. After applying all restrictions in the study, they include 220,265 patients supplemented with vitamin D3, 34,710 supplemented with vitamin D2, and 407,860 untreated patients that didn't take any vitamin D supplementation. So the study results showed that in the population of US veterans, veteran mean a person who has served in a military force. So in these US veterans who were supplemented by vitamin D2 or D3, they were associated with reductions in COVID-19 infection of 28% and 20% respectively. So 28% reduction in in COVID-19 infection in people supplemented with vitamin D2, and 20% reduction in people supplemented with vitamin D3. Also, mortality within 30 days of COVID-19 infection was reduced by 33% with vitamin D3 and by 25% with vitamin D2 supplementation. After controlling vitamin D blood levels, subjects who have received higher dosage of vitamin D have a greater benefits from supplementation. Also, subjects who have lower vitamin D blood levels between 0 and 19 nanogram per milliliter showed more decrease in COVID-19 infection following supplementation. Also, Black veterans uh, showed greater reduction in COVID-19 infection after vitamin D supplementation than white veterans. There are many explanations about the relation between vitamin D and COVID-19 infection and how it improves the infection. However, in this paper, they only talked about interleukin 10 production by T helper cells, which is activated or enhanced by vitamin D supplementation. And this interleukin 10 will play a major role in regulating the inflammation, which is a major character in severe cases of COVID. So vitamin D work here as an immunomodulatory agents, which optimize or make more optimization response from the immune system against infection. Here is the second recently published paper about vitamin D supplementation in COVID-19 infection or severity. This paper was published in QGM or International Journal of Medicine in 2022 October, and the title is Does Vitamin D Supplementation Reduce COVID-19 Severity? A Systematic Review. In this paper, systematic reviews and meta-analysis published from December 2019 to January 2022 that were presenting the impact of vitamin D supplementation on COVID-19 were screened and selected from the PubMed and Google Scholar. After initial screening, 10 eligible reviews were selected. Meta-analysis of 7 systematic reviews showed strong evidence that vitamin D supplementation reduces the risk of mortality in COVID-19 patients. It also showed that supplementation reduces the need for intensive care and mechanical ventilation. Qualitative analysis also have showed that supplements like oral and intravenous vitamin D are well tolerated, safe, and effective in COVID-19 patients. The paper concluded that vitamin D supplementation is effective in reducing COVID-19 severity, and also vitamin D should be recommended as an adjuvant therapy for COVID-19. And as a safe and widely available and affordable treatment, vitamin D may help to reduce the severity of COVID-19 pandemic. I hope you have enjoyed the video, and before ending, I'm reminding you again to subscribe to the channel and to activate the alarming bell if you are interested in getting any updates in my videos, and thank you.